So somebody wanted to know about the neuro-ophthalmology of essential thrombocytosis, sometimes also called thrombocythemia. And I think that is an important distinction because one is too many platelets and the other is platelets that don't work properly. So we abbreviate this as ET, but not esotropia, essential thrombocytosis. It is a form of myelodysplastic syndrome, and it normally presents with anemia or they're asymptomatic and they're found on the CBC to have the low platelet count. And sometimes it's low and high at the same time, and that's why you need to do further testing. So they're going to do a bone marrow biopsy on this person to look for the megakaryocyte, which is the precursor cell for the platelet. And cytogenetics can be performed to look for the JAK2 mutation, which causes the overactivation of the JAK-STAT pathway, leading to the thrombocytosis. And if your whole bone marrow is devoted to making platelets, then you'll drop on the other lines, and so that's what causes the anemia, because all the resources are being shifted over to the platelets. And as you can imagine, the two ways this comes to us is hemorrhage, or thrombosis. And that's a weird concept in itself. So you should know that when you have too many platelets, and especially if they don't work well, it can cause either hemorrhage or thrombosis or both. And that's because hyperviscosity occurs in patients who have anemia. So if you have anemia, you get acidosis and hypoxia and the release of plasma factors, and that can cause you to both clot and bleed. And so that's why we call anemic retinopathy. We say it's from anemia, but really it's the combination of anemia and thrombocytopenia that produces anemic retinopathy, multifocal, bilateral retinal hemorrhages. Those hemorrhages can also appear in your brain or in your conjunctiva, subconjunctival hemorrhage. So that's why in recurrent, unexplained, non-traumatic subconjunctival hemorrhages, we're going to check the patient's blood pressure, but we're also going to do a CBC and a platelet count to look for anemia, but also thrombocytosis or thrombocytopenia. Can also cause thrombosis, and for the eye, that's going to be central retinal vein occlusion or branch retinal vein occlusion, especially if it's bilateral. Or you can have venous sinus thrombosis and papilledema, and it can look like pseudotumor cerebri with non-localizing sixth-nerve palsy, papilledema. So the neuro-ophthalmic manifestations are hemorrhage, thrombosis, and you also have to think about ischemia. That ischemia can occur in their digits, in their hands, and cause digital ischemia, or it can cause paresthesias in their fingertips or their hand, acroparesthesias, or it can cause redness, erythromelalgia, which is limb pain and redness. So it can be red, it can be blue, cyanotic, acrocyanotic, or it can be white, ischemic. So it's just like Raynaud's, but instead of it all coming at once, red, white, and blue, it can be red, it can be white, it can be a blue. Acrocyanosis, acroparesthesias, digital ischemia are all features of this essential thrombocytosis. And they could have easy bruising, that's the hemorrhage piece, subconjunctival hemorrhages, or the thrombotic events, CRVO, BRVO, VST. They need to have CBC, platelet, peripheral smear, bone marrow biopsy, cytogenetics for the JAK2, and the treatments are going to be like chemotherapies like hydroxyurea and antiplatelet agent like aspirin, or megakaryocyte production medicines that would inhibit megakaryocyte conversion to platelet like anagrelide. Those things reduce the number of ischemic events, and in the eye, it might be transient monocular vision loss that mimics amaurosis fugax. So you should know that essential thrombocytosis can come to us as either hemorrhage or thrombosis. That thrombosis can be in your eye or your brain. It can be TIA-like and transient monocular vision loss from ischemia. You need to think about essential thrombocytosis anytime the platelet count is super high. All of them need to go to medicine or hematology to make the definitive diagnosis with bone marrow biopsy and cytogenetics.